Hi everybody, my name is Elijah Young and I will be going over the differences between the roles and responsibilities of state health departments and local health departments. So to start off with state health departments, state departments are responsible for the primary implementation of healthcare, and this essentially includes the collaboration between multiple different agencies across the state working together to combat public health issues going on. And this can include issues such as aging, living, working environments, alcoholism, and substance abuse. Um, so, to go on with this, some agencies have even gone far enough to implement federal acts. And examples of this is the Clean Water Act, the Clean Air Act, the Food, Drug, and Cosmetic Act, and the Safe Drinking Water Act. So all of these acts have been implemented from a state to a federal level. State health departments monitor communities to define and address current or predicted health problems. They also provide education on health-related issues, as well as implement policies and enforce laws and law standards to promote better health outcomes. The state is responsible for addressing priority public health issues as named by the CDC through federal programs and or population-based services. These priority public health issues include, but are not limited to, injuries as it relates to motor vehicles, HIV, obesity, food safety, tobacco consumption, and teen pregnancy and nutrition. The state is also responsible for data retrieval on deaths, births, and marriages, and this is important because it ensures that it basically is necessary for funding purposes for public health programs and services. The Council of State and Territorial Epidemiologists, or the CSTE for short, determines which diseases are worth reporting to the CDC. So off these reports is the CDC bases the MMWR off of these reports or the incidences, and the MMWR is the Morbidity and Mortality Weekly Report, and this essentially outlines the prevalence on reported diseases in the nation. The state departments are also accountable for licensing medical and health professionals within the state. They're responsible for overseeing their educational requirements, testing, and passing of any state exams, and administering those licenses. They're also responsible for overseeing the licensure of health facilities as well to ensure that they're within standard. State departments also are usually responsible for providing technical support to our local health departments. So this can be in services of quality improvement, data control, public health law, human resource applications, and policy development. So to move on to the local government, the local government is responsible for providing direct services to the community, which can differ between local departments as they can carry out services or procedures how they please, but essentially each department gets the same job done. So majority of local health departments facilitate adult and child vaccinations. They offer communicable disease monitoring. Majority provide TB screening and treatment, as well as environmental surveillance. Many of them provide resources that address health disparities, food safety education, and they also majority local health departments receive their funding from state departments, but they can also receive funding directly from the CDC, or in terms of reimbursement from Medicare and Medicaid, or private insurance, or also any fees that they choose to administer. Local health departments are also encouraged to provide educational opportunities for public health leaders and officials, and this is to help strengthen preventative measures through funding and allocation of local resources. Also, the local government participates in emergency preparedness, as well as chronic disease prevention, maternal and child health, injury and violence prevention, and so on. And just to name a few similarities between the two, the HHS, or the U.S. Department of Health and Human Services, operates on both state and local governments. So they have 11 different programs within the HHS that operate on both levels, state and local. And this includes the CDC, the Administration for Community Living, or the ACL, the National Institute of Health, or the NIH, the Agency for Toxic Substances and Disease Registry, or the ATSDR, the Indian Health Service, the Health Resources and Services Administration, the Agency for Healthcare Research and Quality, Substance Abuse and Mental Health Services Administration, the FDA, the Administration for Children and Families, and the Centers for Medicare and Medicaid Services.